Hello, everyone. Today, we're diving into the world of dermal fillers. These injectables have revolutionized aesthetic medicine. They offer a minimally invasive way to enhance your natural beauty. But what exactly are they? Dermal fillers are gel-like substances. They are injected beneath the skin's surface. These fillers work their magic by restoring volume and smoothing out wrinkles. They can also enhance contours. Think of them as liquid sculptors for your face. There are many types of fillers available. Each type has its own unique properties and uses. Some fillers are ideal for plumping up lips. Others are better suited for restoring volume in the cheeks. Whether you're bothered by fine lines or seeking a subtle lift, dermal fillers might be the solution you've been searching for. In the upcoming sections, we'll delve deeper into the fascinating world of fillers. Stay tuned. The journey of dermal fillers is a fascinating one. It reflects the constant evolution of aesthetic medicine. Did you know that the first attempts at filling wrinkles date back to the late 19th century? Doctors experimented with paraffin wax, however, this proved to be unsafe. In the 1980s, collagen-based fillers emerged as a safer alternative. Collagen became the go-to filler. However, its effects were temporary, lasting only a few months. Fast forward to today and we have a new star, hyaluronic acid. This naturally occurring sugar is a game changer. HA fillers are much safer and last longer than collagen. The world of fillers doesn't stop at HA. We now have an array of options. These include calcium hydroxyapatite and poly-L-lactic acid. Each type offers unique benefits. This allows us to tailor treatments to individual needs. Let's break down the different types of dermal fillers and their uses. Understanding these distinctions is key to achieving natural-looking results. Hyaluronic acid fillers. These are the most popular type of filler. Why? Because HA is naturally found in our bodies. It attracts water, providing hydration and volume. HA fillers are incredibly versatile. They can smooth wrinkles, plump lips, and restore facial contours. Calcium hydroxyapatite fillers. CAHA is another biocompatible material found in our bones. This filler stimulates collagen production, providing long-lasting results. KAH fillers are great for deeper wrinkles and adding volume to the cheeks. Poly-L-lactic acid fillers. PLLA is a biocompatible synthetic material that also triggers collagen production. This makes it ideal for treating volume loss and sagging skin. Polymethyl methacrylate fillers. These semi-permanent fillers consist of tiny microspheres suspended in a gel. PMMA fillers are typically used for deeper wrinkles and acne scars. The choice of filler depends on your individual needs and desired outcome. A thorough consultation with a qualified professional is crucial. Administering dermal fillers is a delicate art. It requires a deep understanding of facial anatomy and injection techniques. Let's explore some common techniques and potential complications. The choice between needles and cannulas depends on the treatment area and the injector's preference. Needles are sharp and precise, while cannulas are blunt-tipped and flexible, minimizing trauma. Like any medical procedure, dermal filler injections carry potential risks and complications. These can include bruising, swelling, redness, and infection. More serious complications, though rare, can occur if the injector is not experienced or if the filler is injected incorrectly. Choosing a qualified and experienced injector is paramount for minimizing risks and achieving optimal results. If you have any concerns, don't hesitate to ask your injector about their experience and qualifications.